Intramuscular versus intravenous therapy for pre-hospitalized status epilepticus. So the definition. This double-blind, randomized trial showed that pre-hospitalized treatment with intramuscular midazolam was at least as effective as intravenous lorazepam in subjects in status epilepticus. So here we're gonna see a video.
Hi, my name is Dr. Cesar C. Santos, Professor-in-Chief of Pediatric Neurology. I'm one of the clinical epileptologists here at Georgetown University Hospital. Today I'm going to talk about medical treatments of epilepsy. When we see patients in the clinic for consultation, the first thing we do is to determine whether they have epilepsy. When that decision is made, the next thing that we do is to try to determine what kind of seizures or epilepsy syndrome they're having, because that's going to dictate and tell us what would be the most appropriate anti-epileptic drug to use. We generally divide anti-epileptic medications into two. One is what we call the narrow spectrum anti-epileptic drug, which works specifically for just a certain type of seizures. And then there are the broad spectrum anti-epileptic drugs, which works against different types of seizures. The next question that we ask ourselves is which one would be least likely to produce side effects and still give us good likelihood of making them seizure-free.
So continue. Application in medicine. Establishing intravenous access in patients who are having seizures in the pre-hospital environment can be challenging and time-consuming, since intramuscular treatment can be given more quickly and reliably than intravenous treatment and have no inferior efficacy. Pros. The use by EMS system of intramuscular midazolam for status epilepticus has been increased because small studies have indicated its efficacy and because this drug is rapidly absorbed intramuscularly. Midazolam can be administered by another non-intravenous route as well, but the intramuscular route is more consistent effective than the intranasal or buccal routes, because the drug can be blown or spat out by the convulsion patients. So another video.
Welcome to USMLEFasttrack.com. The section we're going to talk about today is from First Aid for the USMLE Step 1 2013 edition. Page 451. Name the benzodiazepines that are used as first-line drugs for acute status epilepticus. Benzodiazepines that are first-line drugs for acute status epilepticus include diazepam or lorazepam. What is the mechanism of action of benzodiazepines? The mechanism of action of benzodiazepines is to increase GABA-A action. What other types of seizures can benzodiazepines be used for? Benzodiazepines can also be used for seizures of eclampsia. What is eclampsia? Eclampsia is a condition in which one or more emotions occur in a pregnant woman suffering from high blood pressure. In this condition, following convulsions, the patient usually goes into a coma and it poses a great risk to the health of the mother and the baby.
So continue. The cons. The relationships among benzodiazepine dose, respiratory depression, and subsequent need for endotracheal intubation are poorly characterized, but higher dose of benzodiazepine more actually reduce the number of airways intervention. Conclusion. Intramuscular midazolam is not inferior to intravenous lorazepam in stopping seizure because before arriving the emergency department in patients with status epilepticus treated by paramedic. Intramuscular midazolam is also as safe as intravenous lorazepam. The intramuscular administration of midazolam by EMS is a practical, safe, and efficacious alternative to the intravenous route for treating prolonged convulsive seizures in the pre-hospitalized setting. Finally, here a video, a non-effective way to do to make a treatment because it's not efficacy like the intramuscular, but we see alternative to administer midazolam.
Midazolam, name brand is Versed, is another rescue medication that's available for patients with intractable epilepsy. It's not FDA approved for this indication in the United States. It's mainly used for intravenous, but in Europe they're using it if someone's having a seizure and it's a prolonged seizure to help break the seizure from happening.
And so what they do is they use the IV formulation, but they give it buccally, which is in the corner of your mouth, or they give it intranasally. So the medication is drawn up into the syringe and then shot into the nose or the mouth. It's a great option for people who don't want to use rectal Valium or Diastat, or when you're out in public and you're not able to do that.
So
Thank you very much.